So nowadays we have different options in treating PSA, and of course, as soon as you have more than one option or two or three, everybody is asking for a direct comparison between two different products. And now we have two different biologicals. It's a TNF inhibitor, adalimumab, as a let's say gold standard for nowadays, compared to secukinumab, an IL-17A inhibitor for psoriatic arthritis and psoriasis approved. And it is great to have first head-to-head trials now available for a better understanding the value of different treatment options targeting different molecules, either TNF or IL-17. Here at EULAR, we're also discussing the EXCEED study. The EXCEED study is a randomized clinical trial, double-blinded, double-dummy, one-to-one randomized, to compare the outcome of secukinumab versus adalimumab within, let's say, an ambitious goal in the design. So the design was made in a way to demonstrate superiority of secukinumab in ACR20 after 1 year of treatment compared to adalimumab. Of course, this gives us some ideas whether one or the other products are better than others in treating PSA. So this study is interesting based on the design and also on the outcome. So it's a proper double-blinded, double-dummy controlled trial that you are sure that nobody's knowing what kind of product is used, all getting active products. There's no placebo arm in there, and we treat them for 1 year. And the primary endpoint was pure arthritis, which is ACR20. And the dose was used was 300 milligram, say higher dose of secukinumab compared to the standard dose of the adalimumab arm. Higher dose means approved for moderate to severe psoriatic skin involvement or after failing of a previous therapy. So this is a pure monotherapy study. Only the biological is given to the patient, and no previous biological therapy was allowed. At the end, secukinumab failed the primary endpoint to demonstrate superiority against adalimumab, but what came out is that in all the domains, secukinumab is for arthritis at least as good as adalimumab. And what we know from other head-to-head trials in skin psoriasis, of course, secukinumab is superior to adalimumab in resolvement of psoriasis of the skin, which is also demonstrated in this psoriatic arthritis setting, showing a clear superiority of secukinumab in PASI 75 and PASI 90 response rates, showing that the product of secukinumab is superior beyond the clear musculoskeletal symptoms. And the musculoskeletal symptoms, it is as good as adalimumab, at least in some domains a slight numeric trend, but not significant. So, but if you make a kind of post hoc analysis and combining skin outcome and arthritis, like done in other trials to compare different biologicals in PSA, then you came also up with significant differences in those achieving a complete remission in skin plus ACR50, for example. So to sum up, secukinumab versus adalimumab in the skin domains, clear superior also in our PSA cohort, and for arthritis in this 1 year study, at least as good in ACR responses as adalimumab. These two studies are the first head-to-head trial ever in psoriatic arthritis, which is outstanding for us to get these numbers out. And despite the fact that both studies made a totally different, no, not totally, but a design which differs in many important aspects, it came out mainly exactly the same and comparable results. So in the SPIRIT head-to-head, they designed the primary endpoint as a combined endpoint and asking that ICSE might be or is superior in the proportion of patients achieving simultaneous response as PASI remission plus ACR50 in week 24. And the EXCEED study was focusing only on the arthritis domain because it was already known that secukinumab is superior in skin response. And this is why they're focusing in this double-blinded, double-dummy concept only on the arthritis domain after 1 year of treatment. So these are the differences. So they were allowed only to have monotherapy, while Spirit head-to-head allowed to have background methotrexate treatment. The Spirit head-to-head was blinded only for the assessors, but not overall double-blinded, double-dummied. So these are the differences. And the interesting thing is that based on these different endpoints, the Spirit head-to-head met the primary endpoint in this combined version of the proportion of patients achieving simultaneously ACR 50 and PASI 100, while the Spirit head-to-head failed with the superior, while the Exceed failed with the superior of ACR 20 only. But as I mentioned, if I would analyze both studies in the different ways, it would come up exactly with the same outcome. Again, this IL-17 approach, either with ICSA or with secukinumab, is at least as good as adalimumab for the synovitis arthritis aspect, and superior with the skin-linked domains in PSA. So interesting approach. 2 studies designed differently, started in parallel more or less, and it's also interesting to see that the size is different. The Exceed study has a more robust numbers of patients included, while the Spirit head-to-head was a little bit lower in the numbers of patients included. But nevertheless, it gives us confidence in the IL-17 concept and the value of the IL-17 inhibition concept in PSA compared to TNF only.